I'm Meryl Nicol and welcome to another episode of RVTS for GPs. I'd like to acknowledge the traditional custodians of the land and pay my respects to elders past, present and emerging. I'd also like to extend that respect to any Aboriginal or Torres Strait Islander people listening to this podcast today. This is a special podcast episode where we present an excerpt from the 2025 RVTS Grand Round with guest speaker Professor Nicholas Talley. We hope you enjoy it. Good evening everybody and welcome to the 2025 RVTS Grand Round on the Frontline, rural GPs caring for communities in a changing climate. Without further ado, it now gives me very great pleasure to welcome our distinguished Laureate Professor Nicholas Talley, or Nick. Prof. Talley is a neurogastroenterologist, clinician, educator with a research interest in disorders of gut-brain interactions, intestinal inflammation, including eosinophilic gastrointestinal disorders. Nick is currently head of the discipline of medicine at the University of Newcastle, an NHMRC Leadership Fellow and Chief Investigator of the NHMRC Centre for Research Excellence in Digestive Health in Newcastle. He is past Emeritus Editor-in-Chief of the Medical Journal of Australia and past Editor of the American Journal of Gastroenterology. He has over 1,000 peer-reviewed publications, is highly cited and considered an international authority in the field. Awards include the Companion of the Order of Australia, New South Wales Scientist of the Year, and the Peter Wills Medal from Research Australia. His undergraduate textbook Clinical Examination, now in its 9th edition, won first place in the British Medical Association Book Awards in 2018. And if you're only just clicking, yes, this is the Talley of Talley and O'Connor. And Nick is currently the board chair of Doctors for the Environment Australia, and he is very active in advocating about the serious health impacts of climate change and promoting adaptation and mitigation by the health system and the community. We couldn't ask for a more distinguished and qualified person to present for us this evening, so a huge welcome from the RVTS community to you, Prof. Talley, and I'd like to invite you to share your screen and present to us. Thank you.
So thank you very much for the kind invitation. I'm thrilled to be here. I really enjoyed the poll. Thought that was very interesting. That's pretty reflective, actually, of Australian viewpoints about these issues. Pretty close on when you look at the numbers that came up there. About 70% of Australians think this is an important or very important issue. Maybe 20 to 30% feel it's not very important or even basically not even true. Some of them believe that. I'm hoping I can dispel some of the myths that are there, talk about some of the facts. I'm coming to you as a clinician, not as an environmental scientist expert, but I have done some work on this over time, and I hope what I share with you is of some use. I also hope I'll stir you up a little bit, perhaps stimulate you a little bit, and we'll see how you feel about that at the end. So I'm going to talk about the facts about climate change and health. Do we have a duty of care as doctors, as health professionals? And if we do, what should you do? What should we all do? That's what I'm going to talk about. I'd also like to acknowledge the traditional owners of all the lands on which we're meeting today and pay my respects to elders past, present and emerging. There's absolutely no doubt, based on lots of different sets of data, including from NASA, that the global average temperature, our whole globe's average temperature is increasing, and it's continuing to increase. It's now 1.6 degrees Celsius higher than it was today. It's now that much higher than it was in 1991 to 2020. And it's predicted to go up even higher. We've had some of the hottest years on record recently, and while this year may not be quite as hot as last year, it's still looking like it's going to be much warmer than we would like it to be in terms of the impacts already being felt, which we'll come to in a moment. But there's no doubt about the temperature rise. You know, there's no debate about this in the scientific community. It's a very clear set of data. It's objective. And there's no sense that there's some errors here in terms of what's going on in terms of measurement. Why is it happening? We've known about the physics for more than 100 years. We've known about this for such a long time. We know that short-wave solar radiation enters the Earth's atmosphere. Some of that radiation makes it through the atmosphere, it's absorbed onto the Earth's surface, and then it's radiated back into space with a longer wavelength. Visible light becomes infrared light. And greenhouse gases, however, are better able to absorb this long wave radiation. And the greenhouse gases we're talking about include carbon dioxide, nitrogen dioxide, methane, and others. And that leads to a blanket of greenhouse gases absorbing this radiation, which indeed in turn leads to an increase in surface temperatures. So the physics is clear. There's no dispute about this anywhere. This is clear cut. Where are these greenhouse gases coming from? Well, about 25% is natural, volcanic eruptions, etc. And 75%, most of it, is from us burning coal, oil, and gas. Our current greenhouse gas emissions are the highest on the planet, estimated in the last 2 million years, at least that's some estimates. Some have suggested that current temperatures will be even higher, except for the cooling of health-damaging air pollution, such as the sulfates. And the way we're going in terms of temperature rises, it looks as if it's going to get a lot worse than it is today, because we're continuing to produce excessive greenhouse gases, we're continuing to warm the planet, and it's accelerating, it's exponentially rising. And at least many have suggested we're heading to the 3 to the 4 degree temperature increase rather than the current 1.6 degree temperature increase. And there are estimates that the societal collapse level is somewhere in the 4 to 5 degree Celsius range. Some people have suggested a little bit higher, some have suggested lower, but it's definitely a very dangerous situation for us and the planet. Already we're seeing, earth-shattering events. There are many, but let's talk about a couple. Here's one that I particularly was struck by. This was the landslide in Greenland, and this was the collapse of a 1,200-metre high mountain peak into a remote fjord. This is because the melting glacier below was unable to continue to hold up the rock, and there was a 200-metre tsunami. 200 metres. Now, no one was killed. It's quite remarkable. It's such an isolated area where this happened. But the point is, this was really a striking event. And this has been attributed to global warming and the fact that basically we're losing our glaciers over time in many parts of the world, including here. And this is where I think it gets a little more frightening, because it's not just that the temperature's rising, it's that there are multiple potential tipping points that when we reach certain temperatures are likely to occur, or much more likely to occur. These are critical thresholds that when crossed lead to irreversible changes in climate. And so, for example, if we get to melting of the permafrost, thawing of the permafrost, then that becomes a threat multiplier, because the carbon dioxide release would be absolutely enormous if that were to happen. And quite frankly, mitigation strategies are very unlikely to be successful if we're in that kind of situation. The Atlantic meridional overturning circulation issue, this is the Gulf Stream. There's already been some recent evidence published in one of the Nature journals that there has been a partial overturning of this in the southern hemisphere. Now, this needs to be confirmed. It's one report. It did look as if it had changed back, but there was, at least for a period of time, an overturning. If this were to occur permanently, it's been estimated that we will lose the Amazonian rainforest. They'll just dry out. There'll be not enough moisture. And in terms of Europe, well, actually, in that microcosm, it will get colder in winter. Russian winters will occur with very hot summers to boot. So it'll be an absolute disaster for Europe, an absolute disaster for South America. And that's also another tipping point if the Amazon rainforest dies out, because that again will lead to a huge increase in carbon release into our atmosphere and even more global warming. Now, the Secretary General has made some very clear statements. The Secretary General of the United Nations has made some very clear statements about the science of climate change and the risks of climate change. And he has said, for example, just last year that global emissions need to fall, but they are actually rising at the present time. We're going in the wrong direction and we're putting all of us at risk. And I think he's correct. Based on the climate scientists I talk to, the people I speak to, they are really, really worried. Now, I mean really worried, not just a little bit worried. And they're the people who really, really should know. Now, we're health professionals. I'm a doctor. You're mostly doctors here on this meeting tonight. And we're worried about the health impacts. And there are lots of health impacts of climate change. I'm only going to talk about some of them and briefly, and I'm sure there'll be more time for discussion of these issues going forward. But many of us have experienced bushfires. I live on the land. I've experienced bushfires. We've experienced droughts, of course, in the past, and more recently, lots of floods. In my area, north of my area in New South Wales, and also in other parts of the country, we're seeing this occurring, while there's droughts in other parts of the country. I'll talk about heat-related deaths in a moment. There are also risks to drinking water supplies, in fact, sufficient drinking water, let alone contaminated drinking water. The changes in infectious diseases, we're already seeing this happening in Queensland. Melioidosis is increased, gone further south because of global warming. We're seeing mosquito-borne infections occurring at an increased rate coming further south, and this is going to increase, at least according to the models that have been done. We're already seeing it in Australia. More allergies because of pollen in the air, I'll come back to that, and thunderstorm asthma. Increased mental health risks from all of the issues occurring in terms of environmental stresses. Crop failures. Some crops will do well with high CO2, but not many, at least not enough. There'll be many crop failures as well. More crop failures, in fact, than crop successes. And there'll be big changes in crops that will survive and do well. And that's going to threaten food supplies almost certainly if we keep going, which means hunger, mass migration, and almost certainly resource wars down the track. Now, this is not good news at all. This is a paper in the Annals of Internal Medicine, just got published a few weeks ago, talking about heat stroke. It's a pretty good article, but I just wanted to mention that this is now become the most serious heat-related illness. We're seeing more deaths from heat than from cold now. It used to be the other way. And of course, we've got classic heat stroke, which occurs in compromised people and the elderly, but there's exertional heat stroke in young, healthy people working outside in extreme temperatures. There's already more cases of this occurring. You will need to be experts in how to manage heat-related illnesses in terms of seeing patients with these problems acutely, because that's clearly going to increase over time. And there are lots of significant health issues related to these heat injuries, as is shown on this slide. But the bottom line is, this is a killer, and we're going to see more of it. Now, I live in Newcastle, the world's largest coal port, and actually living in Newcastle has its own health risks, because not only do we have coal mining nearby, but we have transport of coal, and we have removing coal waste and all these sorts of things. And this releases basically particulate matter, tiny particulate matter that is a serious health risk, with increases in cardiovascular disease, respiratory disease, premature deaths, well documented in the medical literature. It's even been estimated how many people die for every terawatt hour of coal burn. Now, this is an estimate. You could say, well, it's theoretical, perhaps, but it's certainly not zero, and it's not insignificant. And in fact, looking at the numbers globally, these increases in these ambient particulate matter, tiny invisible particulate matter, is the 5th ranking cause of global mortality. Some estimated it exceeds smoking in some parts of the world in terms of death rates. And none of us think smoking is good for you. At least I don't think so. So air pollution is a huge issue from coal mining, but also, of course, from bushfires. And we're going to see more of these diseases occur. And also we see these acute events like the thunderstorm asthma events which occur because of increased risk of these events because of climate change. And the pollen that's present there can cause serious asthma attacks. And this has happened in Melbourne and other places around the country already. We're going to see more of it down the track. Bushfires, I've mentioned the PM2.5 particles. These covered during the bushfires of 2019, Sydney, Melbourne, Canberra, and elsewhere. There is no safe level of exposure. Any exposure increases your risk. The more exposure, the higher the exposure, the higher the risk. And we had toxic levels of exposure during those bushfire events. And we will see this again because we will have more bushfires over time. No doubt about it. And then what about the other products from petrochemicals, primarily crude oil and natural gas? And that is, of course, plastics. We are absolutely contaminating our environment in plastics. We are all ingesting plastics. We are all breathing in plastics. We get exposed on a daily basis in our food supplies and our water supplies. And it's being recognised now that those exposures are almost certainly harmful, although we still don't know how harmful. But it does look as if they increase your risks of cancer, infertility, perhaps obesity, perhaps neurodegenerative diseases as well. And that is just awful. Let me give you one specific example published in the New England Journal of Medicine last year. And this is looking at the risks of microplastics and nanoplastics ingestion and what happens to the people who have more of this in their plaque, that was documented very beautifully on these electron microscopy studies. And polyethylene was detected in carotid artery plaque in a certain number of patients, and they had a higher risk of bad cardiovascular outcomes during follow-up. In other words, microplastics, nanoplastics, even though they're absolutely tiny, they're pro-inflammatory and they're causing disease right now in your community, in my community, and it's really a disaster. And remember, we as health professionals use a lot of plastic and create a lot of plastic waste. We are partly to blame. Not totally, of course, by any means, but certainly partly. I haven't got time to talk about this, but food and water insecurity is a serious issue with global temperature rises. I've done some reading around this, and I did a course with Harvard, and they went through this in great detail. But bottom line is the data all point to food shortages over the longer term if we keep going the way we're going. Of course, we're already seeing the floods, but the risks of food shortages, malnutrition, etc., the mass migration issues will clearly have health effects. And if you don't believe me, believe the insurance agents, because the insurance companies know exactly what's going on. They are dreadfully worried about this. I was at the UN Climate Week last year in New York, and bottom line is I went to one of the meetings where the insurance companies actually talked about these issues on a global basis. And they would agree with what's stated on this slide. Many, many properties are going to be uninsurable soon, and many, many more soon after because of climate change. They are worried their entire business model may fall over because they can't insure people, which means, of course, they can't make any money, which means, of course, they're out of business as well. So it's clear companies know about this, boards know about this, the companies that produce fossil fuels know about this, or use fossil fuels know about this. It's global warming. We had an article in the Medical Journal of Australia that I commissioned when I was the editor-in-chief. which summarises some of this, and several other articles you can read in the MJA as well if you're interested in learning more about climate change and health. But I would say to you this: if you know the science, if you've read these papers, if you've thought about this, you ought to be frightened. Because if you're not understanding what's going on. At least that's my view. Might be controversial. Now, there are others who feel the exact opposite. Look at Sky News and some of the presenters on Sky News and some of the shows. Here's Andrew Bolt. There is no climate emergency, or indeed, not only is there none, but even if there is one, it's going to be good for you. Warming will be good for you. That's what he says, and he said that several times, multiple times, recently and in the distant past. The fossil fuel companies believe phasing out fossil fuels is a fantasy, despite the fact that we have these global agreements, the Paris Accord and others, indicating we actually need to cut back on our use of fossil fuels, on our production of fossil fuels. And you know what's happening in the United States. The new administration, the Trump administration, is actually drilling more. Drill, baby, drill is the mantra. And they are continuing to increase oil production because in the short term it makes money, and that's what matters to at least some people in the global community. And I understand that, except it's putting all of us potentially at risk. Now, interestingly, The Guardian actually reported a couple of years ago in 2022 that Sky News Australia was the global hub for climate misinformation. The global hub, not the local hub, not the hub in Australia, across the nation, the global hub. Now, you could argue that Guardian got this wrong, but it was a compelling article, worth a read if you're interested in actually seeing what they had to say. So when I went to a meeting and talked about this at the DEA, I put this slide up just to show that what I thought about, indeed, this issue, that we were seeing stuff coming out of certain media organisations that really were incorrect. A few days later, I appeared, not in person, but my photo of this slide and some other things appeared on the Andrew Bolt show, actually, very interestingly, where I was told because I talked about climate change being a risk to health and a risk to society, I was a hypocrite. I wear the hypocrite badge with pride because I feel it's important to recognise that if you speak out, you may have to deal with such criticism. And that's fine. People are allowed to criticise. But when it comes to the science, it's absolutely rock solid. It is not debatable science. It really isn't. Now, I got this from X, from Twitter. This was a really nice little cartoon, which I've borrowed, and it sort of talks about the climate change timeline for those who don't believe in any of this. Basically it isn't real to begin with, and then, oh yes, it might be real, but we're not convinced it's caused by humans, or it may be good for you. But we're coming to this stage now. We're coming to the oops phase because we're seeing events right now, this year, last year. And of course, there's another phase which I've partly covered, which is not the best phase, four-letter phase, which is what people are going to feel very strongly when things go really south. And they are going to go south. That's the important point to make. It's not funny. It's going to be very serious. It's a wicked problem, though, because we need fossil fuels still to run things, for many things. Yes, we're seeing a change there, but it's still the case. But we've got to do more, and doctors have a role to play here. We need to be leaders in climate change in terms of making a difference. We need to join the Farmers for Climate and other groups that are speaking out, and we need to stand up and say, for our communities, this really matters. And I think that's an important issue. And I'd argue doctors have done it before. We're not new at this. This is something we've done before. Look at the smoking story. Remember, the tobacco companies used to try to have misinformation about the health benefits of tobacco in the distant past. And when that didn't work, they tried to suggest that, well, smoking wasn't such a big deal anyway, not such a risk factor, which nobody believes these days. But that's what happened. And we had doctor ads where doctors were smoking and saying how wonderful it was, we smoke. It's very much the same today with fossil fuels, I would argue. And look at vaping. We just banned it. We just banned it. It's as simple as that. Legislative change can make a huge difference. We haven't had the courage to do that with fossil fuels. We still support fossil fuel production with government subsidies, billions of dollars, around about 11 billion a year. Enormous amount of money we spend supporting people who are damaging our health, our community's health, our children's health, our grandchildren's health, and are continuing to do so. So I would argue this. We have a duty of care as health professionals, as doctors in particular. And there are multiple pillars of responsibility. I've talked about this. There's this nice article in Cell that summarizes it pretty well. And what's been suggested is these 5 pillars are education, research, building resilience, decarbonizing, and so forth. So what do we do? What can we do as doctors in addition to some of those things? And I'm going to talk about some of those approaches in a moment. Well, I think we do have some personal responsibility. This is a very nice article by a gastroenterologist in the United States who had an electric vehicle, by the way, about his carbon footprint. And interestingly, it was air travel for him that was the biggest carbon footprint piece in all the things he did. But there were other things as well, including use of gas, etc. So look, we can work this out for ourselves, and we can lead by some example in our families, in our communities. And I would suggest that's a great thing to do if you believe this is an important issue. And if you don't believe it's an important issue, you've missed the science, in my view, anyway. Systems can make a difference too. Look, in the United Kingdom, the NHS became the world's first national system to commit to carbon net zero. It was led by Nick Watts, an Australian who was NHS England's first chief sustainability officer. Nick's now in Singapore doing exactly the same thing. And basically they had a huge success, and the staff mostly loved what was going on, reducing waste, reducing carbon emissions, making it a better place to work in, a safer place. And the NHS loved it because it saved them money. It actually cost less to go green. That's a really, really important result. And it's exactly what we found at John Hunter Hospital. Going green started to save more money in our health system. Yes, it really, really does. And in fact, at John Hunter Hospital, which is one of the leaders in the state of New South Wales in terms of emission reductions, they've been on this journey. It's been a top-down and a bottom-up process. They've really done some innovative things, and they've made a difference to reducing this carbon footprint. And I would suggest this could happen in every health system, in every hospital in the country, if there's the will to do so. But right now, this is somewhat patchy. And certainly there are other hospitals which have done this as well, in Melbourne and elsewhere, Sydney as well. But really, there are still big gaps in our systems. For example, John Hunter's installed the largest solar panel array in the nation in the hospital system. And, this is generating green electricity, saving money. And saving money is a great thing, because then you have more dollars to put into actually delivering health rather than spending it on emissions, etc. Other things we can do personally, as well as try and get the system to change, is reducing our own waste when we're working in our surgeries, in our hospitals. And also we can convince our societies, if they're still sending us paper-based journals wrapped in plastic, as are my societies from the United States, the International Gastro Societies, they still do this. It's absolutely horrifying. They come, talk about waste, all this plastic, all this paper. None of us really read paper journals anymore, and yet that's what's still coming. So you can lobby to get that changed. When I was president of the College of Physicians, we made some changes there. I've made similar changes when I was editor of the Medical Journal of Australia. It can be done. It just takes some willpower to do it. And if you want to work with others to make a real difference, I'd argue, think about joining Doctors for the Environment, because that's an organisation dedicated to dealing with trying to make a difference here. They know the science. They know it well. They are doing their very best to make sure that we have a much better health approach to this going forward. And doctors and medical students are extremely welcome. Anybody is extremely welcome to join. If you're not a doctor or a medical student, you can join as a friend of DEA. It costs very, very little to join, but really what this is about is making a real difference. And indeed, for example, DEA's launched a hospital sustainability project tracker, launched it late last year. This is aligned with the Australian Commission on Safety and Quality. It's being used by multiple hospitals around the country, and it's just one example of the activities of some of the members who've worked hard to try and make a difference. Now, you might suggest this, and some have, well, if we can't get our emissions down ourselves, maybe we can use technology to stop climate change. And I want to talk just for a few seconds about this because it's worth thinking about. The answer is it's theoretically possible, but we don't know if it's practically possible. Some of the radical interventions, like releasing more sulfate particles, increasing cloud cover, using mirrors, reflective films, or fertilizing oceans with iron or other nutrients to enable plankton to absorb more carbon. These ideas have all been raised. Some of them have been pilot tested, like releasing into the atmosphere. But the bottom line is we don't know what the risks versus benefits of all of this is. And then there are machines that have been made which actually can take out CO2. Take it out, you bet. Mammoth is one of these. It captures carbon dioxide before it's released. It stores it deep in the earth. It sort of has a way of doing this. And basically you end up with this carbonate minerals that are the CO2 that is not able to be released. But it's, of course, very expensive. And it's been estimated one of these huge machines will capture 1/1,000,000th of annual global emissions. They built 7 of them in Texas. In the meantime, they've increased drilling in Texas, so it's double or triple. Bottom line is 7 machines won't make much of a difference, unfortunately. But despite this, it's very interesting that in some states in the United States, it's going to be banned that you solar geoengineer. People are worried about chemtrails over there. Worried that somebody's poisoning them with chemtrails, and they're worried that if we interfere with geoengineering, if we even test it in the atmosphere, then we might cause terrible, terrible, terrible harm. And bills have been passed, for example, in Tennessee, banning it altogether. Not exactly progressive thinking, but still, that's what's happening. So I'd just like to bring it all together briefly. We have one home. Really, that's all we have. This is a very nice picture from Voyager 1 at a distance of 3.7 billion miles away from the sun. And this is the little blue dot. This is all of us. It's everyone who's ever lived, everyone we've ever known, everyone that we love, really everything that we know. That's on that tiny, tiny, tiny blue dot in a huge expanse. And if we don't protect the dot, if we don't protect our planet, our own health, our own lives are at high risk. And that's what we're doing right now. We're playing with risk, and we're playing with risk in a certain way that is going to be, it's already very destructive. I've argued it's bad, and it is, but there is hope. We are not at any tipping points yet. We haven't seen the devastation that will occur if we hit some of those tipping points. We know global warming hasn't run away yet. We also know if we continue as we are, it will run away. It's almost a certainty. It's almost a certainty if we don't change things. So it's a very interesting conundrum. If we ignore the problem, we have a disaster, but we can do something about it if we take action, and all of us have a role in taking action. There is an agency that we act quickly, we act dramatically. What can you do? What can you do as rural GPs, as rural leaders, as people who are listened to in your community? You can do an awful lot of good if you want to. You can develop and implement local disaster plans for managing heat waves. You can educate patients, the community, your friends, everybody else. You can look at the ways to support mental health resilience, because that's going to get worse as climate change worsens and we see more droughts and floods and fires. You can work with local councils and other stakeholders to make a difference. You can develop ways of caring for people that is green friendly. You can advise patients on lifestyle changes to reduce their carbon footprint. You can empower others to make a difference. You can promote policies with local politicians, councils, etc. You can advocate for the environmental sustainable policies that will make a difference and really make sure they get passed. You can participate even in research if you want to look at the effects of climate change over time. So I finish with this. And I think this is important because I've already expressed to you my belief, and the science backs it, that we have a problem. And I want you to think about it because I think about this pretty frequently. I've got kids, I've got one grandchild. What am I going to say to the next generation when they ask me, and they already have asked me actually, what did I do? What did you do about climate change? And I suggest, I hope the answer is going to be something like this. I'm hoping you're going to be able to say, I acted with foresight, with conviction, with courage, and especially with urgency. Thank you very much.
This concludes our special Grand Round excerpt with guest speaker, Prof. Nicholas Talley. We hope you've enjoyed it. Thank you for listening to RVTS for GPs. Download previous episodes on the podcast app of your choice, and please like and subscribe to help others find us. Have a great day.
The views expressed in this blog, including but not limited to opinion statements or perspectives, are solely those of the individuals involved and do not necessarily reflect the views, opinions or positions of RVTS. Likewise, do not use this podcast for medical advice. Instead, see your own GP for medical care. Have a wonderful day.